Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is women's mental health. My co-host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan. How are you doing tonight?
Hey Faisal, it's great to be here with you. This is a timely topic for the holiday season.
Yes, it is. I am so thrilled to have our guest on joining us tonight. I, you know, when we just in general, when we talk about mental health and the state of affairs in the country with mental health for everyone, even including our children, the impact with all the distance learning and everything that has happened because of the pandemic, and then even recently with the news that we're hearing, all the anxiety that's coming with the news that's coming from around the world about another variant. I think it is a timely topic. So without further ado, let us welcome our guest for the evening, Dr. Sipra Laddha. Dr. Laddha, welcome.
Hi, I'm happy to be here.
Thank you so much for joining us tonight. I'd like to start off by talking about your life journey. Most of our audience are residents, they're physicians. We love hearing stories about why you ended up pursuing your path in life.
Yeah, so I'll start off from kind of when I was a kid. Both of my parents are physicians. Medicine was what I knew. It was what I grew up around, and my parents were very passionate about their trade, and I knew that I wanted to be passionate about whatever it is that I did. And so kind of did the typical pre-med. I actually graduated a year early and went to med school a year early because I was so excited to get in there and help people. And then I got to medical school and did a whole bunch of rotations. I was very interested in neurology. I had done a lot of research in neurology, and I somehow drew the short end of the straw. And I got to last pick out of my entire class. I think there were 135 of us. I was like 132 to pick my rotations and my schedule and things like that. So I didn't do my neuro rotation until fourth year, like the month before we had to apply for specialization. So I went through, all my rotations, just liking some things, not liking other things. And I found with all the extra time that I had, all the electives, I was taking psych rotations. I did emergency psychiatry, which I thought was really interesting. I did a little bit of perinatal psychiatry, but thinking I'm going to be a neurologist. That's the plan. And then I did my neuro rotation a month before I was supposed to apply to residency, and I was like, wow, I don't want to do this. I thought it was a great field. I love the people that I worked with, but it's like, what was it that really motivated me? And I kind of just looked at my rotations and the places that I had the most fun, and the places that I was naturally drawn to was psychiatry. I think that disease process is really interesting. But what I was finding is that the way diseases affected people and dynamics between patients and caregivers, patients and their families, patients and their society, was just wildly interesting. And so I kind of had an answer. Called my parents and I said, I think I'm going to do psychiatry. And they were like, okay, I think that sounds okay. But what is psychiatry? They especially coming from India, there's not a ton of awareness around mental health and what the actual field is about. So then I went off to Emory and I did my residency there, really enjoyed it, got to see a lot of different pathology, a lot of different settings. So, inpatient, outpatient, private hospitals, county hospitals, and had a great time. My last year of residency, I became unexpectedly pregnant with twins just as I was applying to child and adolescent fellowship. And I remember when I found out that I was pregnant, I was like, I was due the month that I would start fellowship. And I was like, I can swing it. I'll figure it out. I'll do it. And then we found out it was twins. And I was like, I don't think I'm swinging anything. I think I maybe just need to give this some space in my life. And so I did a chief year. I was at the VA really helping to kind of fill gaps in care. And I also did perinatal specialization under Toby Goldsmith, who runs the perinatal clinic at Emory. And it was a really interesting time in my life because here I was with this high-risk pregnancy. I had monodi twins. They were sharing a placenta, getting regular care, sometimes weekly ultrasounds, twice weekly ultrasounds, I was working in the perinatal psychiatry clinic and kind of looking around and being like, wow, this is, really interesting field. Didn't learn anything about it until my 4th year of residency. And it's highly specialized and highly needed. We would have patients that would sit on the waiting list pretty much their entire pregnancy. And so they would, try to book an appointment when they were a couple of weeks pregnant or when someone referred them to care. And then we were seeing them in the clinic sometimes 2, 3, 4, 5 months after they delivered. And so realized immediately there's a huge gap in care there. There's a lot of difficulty with availability. And then also just going through my process, my OBGYNs were wonderful. They did exactly what I'd hoped that they had done. My perinatal specialist, they got my twins here happy and healthy at 36 weeks and 3 days. But I probably had 45 touch points with them before I delivered, and there was no single screening at all for a perinatal mood disorder. You know, they did everything that they were supposed to, but I started noticing like there really isn't much support for this. There's no screening. There is no way to kind of pick up in a routine and systematic way what else might be going on that would be affecting the pregnancy in metrics that aren't, normally measured right now. And we also know that women who are carrying twin gestations or multiple higher order gestations are 3 to 4 times more likely to develop perinatal and peripartum mood disorders. And so it kind of started my journey with perinatal psychiatry and really women's mental health, noticing that there's a lot of work to be done.
Wow.
And so I had my twins. I graduated from residency. Right out of residency, I started my own women's mental health private practice. I also worked at the VA for about 7 years in women's mental health there, and also in plugging holes and kind of figuring out systems issues. And just recently, about 6 months ago, I and a child and adolescent psychiatrist, Dr. Rathi, started Thriving Lane, which is a women's mental health focused telemedicine platform that is currently in Florida and Georgia and quickly expanding to other states, which is focused on kind of making sustainable solutions for women's mental health.
Gosh, what an incredible story. I love this. I love these stories. I mean, they're always wonderful stories about how people end up. I was wondering the story behind getting Thriving Lane started and even specializing and focusing on women's health. I'd like to talk a little bit more about why you feel women need a specialized approach towards mental health.
Yeah, and I'll answer that kind of in two veins. One is that why Thriving Lane and why deciding that we needed this solution in women's mental health was because I was getting to the point where and I live in a big city. There's a lot of psychiatrists around me. There's actually way more access to care here than there is in most parts of the U.S. And I was getting to a point where I was squeezing people in during lunch breaks and before work and after work and on weekends sometimes, and kind of sat back, especially during the pandemic. The numbers, the referrals were going up, and started thinking like, what can we do to really have a sustainable solution? Just having one more practitioner see one more patient a couple of times a week, that's not a sustainable solution. And so we realized that there is a big gap in the workforce around this, right? So mental health is kind of interesting in that we have therapists, LCSWs, psychologists, LMHCs, people who deliver therapy. And then we have psychiatrists who are physicians and have been trained in medical model. And then we have the other subset of physicians and practitioners that are seeing these patients, which are OBGYNs, primary care doctors, family medicine doctors. And there is not good communication between the three at all. Medical people are focused on medical, therapy people are focused on therapy, psychiatrists are somewhere in between, but often just kind of overloaded and trying to catch balls as they drop. Uh, and the therapists are really missing the medical piece, which I think is so important in women, especially in women. There's multiple transitions that are uniquely female, whether that's puberty, pregnancy, all the things that happen before and after pregnancy, miscarriage, infant loss, perimenopause, and then the social changes that go along those times as well. And so, especially for women, because there are so many transition points, unlike in men, especially for women because there are so many transition points that are biologically mediated. It is really important to kind of have that marriage of medicine and psychology, and kind of get women's mental health as a priority.